And over in Ireland, the government has already approved a plan to gradually reopen the country. That and more news from our EBC correspondent, Rowana Bianca Arino. Hello, Rowana. Thank you for joining us today.
Hi, Alma. How are you?
I'm good. How are you? Good to see you.
I'm good as well. Thank you. Nice to see you too.
Okay, what are your updates for us?
So for my update, current restrictions introduced to deal with COVID-19 are expected to largely remain in place in the coming weeks as the government will approve a plan to gradually reopen in Ireland. The plan is also expected to be subject to ongoing changes over the summer months, with individual measures open to alteration or reversal. However, there is pressure from ministers to ease the cocooning recommendations for those aged over 70 and widen the 2-kilometer travel restriction. Some TDs, or Táchtaí-Dála, who are the deputy to the lower house of the Irish Parliament, have also called for hardware and DIY shops to reopen. The National Public Health Emergency Team will make recommendation to what Taoiseach, Prime Minister Leo Varadkar, called a roadmap to reopen Ireland. The government will also announce an overall package of supports to go in tandem with the easing of restrictions. Mr. Varadkar said easing restrictions would depend on the progress of COVID-19, along with healthcare capacity and resilience, testing and contact tracing capacity, the ability to shield at-risk groups, and the risk of secondary illness. He said the lifting of restrictions would be done in a stepwise steered manner, but restrictions may have to be reintroduced if it looks like the virus is going to surge back. It is expected that the existing restrictions will be in place for a number of weeks, expected to be a fortnight, past their initial May 5th expiry date. At a previous briefing for ministers, Chief Medical Officer Tony Holohan said the plan would be reviewed in 3-week cycles. Cabinet sources said that divisions between ministers who want to ease restrictions relatively quickly and those who were cautious has become more obvious, with one predicting the upcoming meeting may not be all plain sailing. The initial stages of the plan predict allowing the over 70s out for a walk on a no-contact basis, with sources previously suggesting that others may be asked to stay at home while cocooners are out. Meanwhile, there was no agreement reached in talks on Thursday on a proposed new national safety protocol to apply in workplaces. It is understood that detailed guidance will be given for workplaces in areas like social distancing and cleaning protocols, as well as around canteens and other gathering places. Office workers will be encouraged to work from home, and flexible working hours will also be encouraged when offices return to avoid overcrowding on public transport. Builders hope to restart the construction industry by picking up work in almost complete sites before moving to outdoor work on sites such as housing estates and then moving to new estates. Businesses and manufacturing are expected to open in the early stages of the plan if they adhere to social distancing and health rules. The Health and Safety Authority and environmental protection officers from councils are understood to be tasked with ensuring such requirements are met. Ministers for Business Heather Humphreys told the Irish Parliament Assembly that all businesses must adhere to the guidelines when they are reopened. She said they would be backed up through inspections and enforcement using the full suite of resources available across the state. Separately, Minister for Justice Charlie Flanagan has said the Police Service of the Republic of Ireland is planning an extensive operation this bank holiday weekend to ensure that the public adhere to travel restrictions. Back to you, Alma.
Hello. Okay, so Rowana, nursing homes account for 50% of the coronavirus deaths in Ireland, according to new figures from the National Public Health Emergency Team. I don't know if you have right now, but could you give us a picture of a patient and senior care in Ireland, if you may?
So the Taoiseach, Prime Minister of Ireland, Mr. Leo Varadkar, also expressed a concern that people who need medical help are not seeking it. Mr. Bradker said Ireland was now in sixth place in the world for testing per head of population, and 160,000 tests had been carried out. Currently, personal protective equipment is being delivered regularly to nursing homes here in Ireland, but there are concerns that in nursing homes with no COVID-19 cases, that there is the risk that someone who was doing the testing could bring it in.
And workplaces will be closed down for breaches of social distancing under the plans being considered by the government to reopen the economy. The Health and Safety Authority, or HSA, will be given new powers to inspect and shut down workplaces if they do not comply with the guidelines to be published soon for reopening businesses after the nationwide lockdown. Could you please discuss this and other developments on the road to reopening? What are the criteria for the reopening stages?
Yes, so in the DAL, the Prime Minister identified 5 criteria for future decision-making on restrictions. This includes the progress of the COVID-19, along with the healthcare capacity and resilience, testing and contact tracing capacity, the ability to shield at-risk groups, and the risk of secondary morbidity. So this roadmap to open Ireland is to a new normal is being developed, and it's on its work to be approved. However, the changes to the current restrictions will be made every 2 to 4 weeks and will not happen as fast as the restrictions were put in place. He warned that restrictions may have to be reintroduced if it looks like the virus is going to surge back. He said that they will find a way out of the tunnel, but we are still in the tunnel and have some distance to go to.
I also learned, Rowana, that you are an engineer. You work as a regulatory affairs engineer in a company that makes respiratory medical devices. Can you tell me more about this?
That's right, Paul. I'm a regulatory affairs engineer for a medical device company that is a global leader in providing respiratory devices. So they're focused on spirometry, which is a test used to assess how well the lungs work by measuring the air you inhale and exhale. So where these devices help in the current pandemic are for those who've recovered from COVID. As we know, one of the symptoms for COVID is breathing difficulty. So a set of pulmonary testing would be needed to determine the health of the lungs, followed by the damage impacted by the virus. So these respiratory devices that we provide would greatly help medical professionals in diagnosing before the conditions of the patients worsen.
All right. Thank you so much, Rowana, for your time, and really appreciate it. Thank you so much. Stay safe, stay healthy.
Thank you. Thank you. Take care, everyone. I'm Rowana Bianca Arino, correspondent in the Republic of Ireland, and we live in interesting times.